All right, it's Wednesday night, and we're here with some ladies of Evocient Gynecology. We have Dr. Ojo Cairns, and we have Erin Glace, who is a physical therapist who has a specialty in the pelvic floor. You've got basically a whole alphabet behind you. We were just chatting before we went live about what all it entails to be a pelvic floor physical therapist. I think that's just for me, it's not a known thing. And I'm so excited to hear more about what you do.
It is very much not a known thing. And I think that's definitely been my soapbox as I've kind of advanced in my career, is trying to make women more aware of the pelvic floor and all the things that the pelvic floor does and can affect. So when we talk about the pelvic floor function and what a physical therapist that addresses pelvic floor does, is we look at the muscles inside the pelvis that control bladder control, bowel control, sexual function, and often core stability. So even sacroiliac joints, like sometimes patients with SI joint dysfunction really have a pelvic floor dysfunction as well. So if you have problems with bladder control, and here's where the confusion comes in oftentimes, because if you are going to your doctor and you're saying, look, I am urinating frequently, I have to pee all the time, or I'm leaking urine when I cough or sneeze or run, you think that it's a bladder, that it is the function of the bladder. But a lot of times it's not. It's the muscles that help to control the bladder that we can actually have really significant change and improvement on, with by learning how to control the muscles. And it's not just specifically, oh, just do your Kegels. That's a very kind of trite thing. Yes. Dr. Ojo Cairns is saying, it's not just about doing Kegels, because that's just a very simplistic answer. And it's too simplistic when we're talking about that. Do you want to add anything to that, Dr. Ojo Cairns?
No, I totally agree. And, I also think oftentimes you hear, do your Kegels, but then there's no instruction on how to do a Kegel.
Right.
What do you get in the end? There's no finish line for it. So every once in a while I think to do it, and then I'm like, did I do it?
Right. Did I do it?
Now?
Did I do it? Yeah.
Right. And, interestingly, Hannah, when you do Kegels, oftentimes people think all the time that their pelvic floor muscles are weak. It's like, oh, I have to do my Kegels. And, patients will come in and say, I need to strengthen my pelvic floor muscles because I'm having pain or because I'm having overactive bladder. And the reality is that oftentimes it's not that the muscles are weak, it's that the muscles are overactive. They might be short and tight muscles. So if you imagine that your biceps muscle is short and tight and you can't completely extend your elbow, it's not going to work well. And, and if you try to extend it beyond that range of motion that's available, it's going to hurt. But you can see it, and you can see that limitation. But with pelvic floor muscles, you cannot see that limitation. And oftentimes, if you're dealing with women who are postpartum, which postpartum means basically you've had a baby, anytime in your life after you've had a baby, you are postpartum, right? Where I've had 3, they're grown, I am postpartum. So if you're postpartum and you've never had really good education about how the pelvic floor works, you can't often feel those muscles. You can't feel the contraction. You're not sure what you're doing. So, I think, as Mary alluded to earlier, we do our patients a disservice when we hand them their newborn and say, don't forget to do your Kegels. Or when, women come, and they say, I'm having these bladder control issues. And the answer is, well, do your Kegels. Well, just do your Kegels. You'll be okay. You'll be okay. And you had a baby, so.
You mentioned the idea earlier of if you've been in a car accident or something, or some traumatic event, or of course would seek physical therapy. You wouldn't think twice about it. I'm 2.5 years out from my last pregnancy, and I have occasional pelvic pain, which I've just come to accept as just how my body is now. That's just the way it is. I don't have good pelvic floor understanding. That was never part of my training.
Right. And unfortunately, it's not part of a lot of women's training because, again, there are good qualitative studies that have this, that we know that women will often get their information regarding pelvic health not from their medical professional care providers, but from their friends, from their mom, from neighbors, I don't know. So that, so we've kind of passed on this tradition of, well, yeah, I had that. So I guess that's just part of, where you are, what's going on, and in terms of like rehabbing from postpartum and, specifically the pelvic floor, whether you have a C-section or you have a vaginal birth, you're going to have a stretching of the pelvic floor. You're going to have the abdominal muscles are going to have some effect. We know that all muscles are over, all the abdominal muscles, the pelvic floor muscles, even up to the respiratory diaphragm, some of the low back muscles are all affected by even the most, and I wouldn't use the word perfect because, but the pregnancy and delivery that maybe results in very minimal pain or dysfunction afterwards. There's some injury and it's all relative. So, but we do diminish that very much. And if you're in an accident, if you have a very bad sprained ankle, or you're in an automobile accident, have a knee injury, we wouldn't even think to say to that person, well, you'll be okay. Just kind of, squeeze those muscles occasionally, even though it's really hard to feel them right now because it's swollen and all of that, but you'll be okay. And by the way, here's a baby that you're completely responsible for. You're exhausted, but it's okay. You'll be okay. You'll be okay. And we've all done it. So,
We're here. We're okay. So you'll be okay.
Right.
But in actuality, we're not okay.
I was going to say that. Exactly. I was going to say that. We're not okay. We're not okay. I mean, we know in terms of just incontinence, right? You have more and more levels of incontinence, leaking of urine, and that can be with a cough, a sneeze, an urgency, movement, that increases that, the amount of that increases. We have a higher frequency of that type of symptom presentation as women age, but we also know that it's definitely directly related to multiple childbirth. We also know things like prolapse or descent, like the bladder coming down or the bowels coming down or the uterus coming down, are also directly related to pregnancy and delivery. So,
prolapse itself, the number one contributor to prolapse is just pregnancy, not necessarily how you deliver, but just being pregnant, like you alluded to, or you said earlier, Erin. You are stressing the pelvic floor. There's a lot of pressure on the pelvic floor during pregnancy. Imagine the weight that you're carrying during pregnancy. Forget just the 8-pound baby. You have the fluid, you have the placenta. So there's a lot of, and then you're just also stretching, your pelvis does stretch, your ligaments become looser during pregnancy because of the hormones of pregnancy. So there's a lot of trauma from pregnancy itself that's caused to the pelvic floor and leads to what we're talking about, incontinence, prolapse, pain.
Exactly. So intervening early. Why do we not intervene early? Why do we not? I think that's one of the things that I just love about Dr. Mary Ojo-Cairns is that she educates women and that we are about intervening early. And it's like, how can we, step in and take this proactive approach to pelvic health? Because it is these symptoms and these, symptoms are so impactful. They make a huge difference to quality of life, to the ability to live, to perform your activities that you want to exercise. If you stop exercising because you're leaking, the impact on your overall health is huge, not only for just the physical health, but the mental health aspect of that. And then so many women have like a shame about it, you know.
I was going to say, you guys are so assuring and comfortable and so professional. It feels so comfortable. I'm just in conversation with you now, but to approach with something that is so vulnerable. So Evotient's taking patients now. If someone is to call in and say, I saw that live and I am experiencing some of the symptoms that were mentioned, would they first see either one or the other of you, or how does your relationship work in tandem to provide this holistic care?
So what we, do first is have a baseline evaluation with me to discuss the symptoms that the patient's having, and also discuss what we offer at Evocient. And so the first visit is with me, and then they would have a follow-up visit with Erin for management, for evaluation, and then determination of management, and then continue as such.
Right. And I think that I love the teamwork between physician and PT, because I do think that it's important that women are assessed correctly. And that, pelvic floor therapy is prescribed for patients who will benefit from pelvic floor therapy, because we want to make sure that we are directing in the correct way, and that there's not something else going on that would require more of a like the medical physician side management. So I like to have physicians, Dr. Mary Ojo-Cairns, referring, because then I know that this patient is somebody that we can make a difference with, and that we can, jump in and start working together. So
to Erin's point, pelvic pain, even though we are talking about the pelvic floor and concentrating on the pelvic floor, there are other causes of pelvic pain, other disorders that can cause pelvic pain, organ issues and such. And so part of that evaluation is to assess for other possible causes of pelvic pain. And then even if the pelvic floor is a major player or has responsibility for the condition, that doesn't mean that it's the sole cause of it. So it may be multiple causes in the case of endometriosis, enlarged fibroids, so on and so forth, that you have to have more of a comprehensive approach. Physical therapy is medical therapy, but you may need multiple types of medical therapy.
Exactly.
And how nice for patients to have that all under one roof with you coordinating with one another. Oftentimes you would get a referral and then you might have to go somewhere different. I think that's so nice to have it all under one roof. I want to just take this moment to say that if you're watching this and you have questions, even if it's after the live, please drop those questions in the comments or send us a private message. We'd love to be able to answer those questions in a future session. You had mentioned, Erin, that that this can also be a treatment for endometriosis. And I had endometriosis and actually started my journey to become pregnant as a way to treat the endometriosis. And I wish that I would have met you sooner.
Right. When you have a chronic pain condition, and that is where the teamwork between physician and physical therapist, especially in this realm, really is important. When you have a disease, the endometriosis, that creates a chronic pain, we have to recognize that the body will respond to that pain. And so sometimes, the primary driver being the endometrioma, the inflammatory process, is a big part of the pain. But we know that sometimes even when that's removed and post-surgery and post-care, we continue to have pain. And that's where physical therapy comes in, because we work with patients and teaching them how to reduce those other pain drivers, be it pelvic floor, abdominal muscles, or nerves. A lot of times the nerves are very upregulated, and we can work with that.
Yeah, you mentioned pelvic floor stopping people from exercise, but I mean, it also has an impact on people's sexuality, and a big lasting impact on your relationship as well. I'm sure.
Absolutely. One of the primary reasons that a lot of women will come to physical therapy is because it is impacting their ability to be intimate with their partners.
Well, that feels like it opens up so many questions.
Whole other conversation.
That's right. We'll have you back. We'll have you back, or better yet, people can call an appointment.
Absolutely.
Thank you so much for your time, ladies.
Thank you.